The heart is a hollow muscular pump. A normal heart is composed of 4 chambers: the right atrium, right ventricle, left atrium, and left ventricle. Deoxygenated blood, shown as blue, returns from the body into the right atrium. Next, blood moves into the right ventricle, which pumps it through the pulmonary artery to the lungs to be oxygenated. From the lungs, oxygenated blood, shown as red, returns to the heart into the left atrium through 4 pulmonary veins. It then enters the left ventricle, which pumps blood through the aorta to the rest of the body. In the uterus, the fetus receives oxygen from the placenta, so blood can bypass the lungs. Blood bypasses the lungs in two ways. One way is through an opening in the wall between the right and left atrium called the foramen ovale. The other way is through a connection between the aorta and pulmonary artery called the ductus arteriosus. Normally, these openings close a day or 2 after birth because of increased blood pressure in the left atrium causes the foramen ovale to close, and the presence of oxygen causes the ductus arteriosus to close. The baby's heart will then continue to pump blood normally through the lungs to the rest of the body. Hypoplastic left heart syndrome occurs when the left side of the heart does not form normally. The result is that the structure of the left side of the heart, including the aorta, aortic valve, left ventricle, mitral valves, and the left atrium are very small or hypoplastic. As a result, the left side of the heart can't pump blood to the body properly. However, oxygen-rich blood returning from the lungs can bypass the hypoplastic left heart by passing through the foramen ovale, which has remained open into the right atrium. There, oxygen-rich blood mixes with oxygen-poor blood returning from the body. Then, the blood passes to the right ventricle and is pumped through the pulmonary artery to the lungs, as well as to the ductus arteriosus and to the body. If a hypoplastic left heart is left untreated, the foramen ovale or ductus arteriosus, or both, will close as they normally do after birth. As a result, blood flow to the body is not only low but is also oxygen poor, endangering the baby's life. A series of operations as well as medications are necessary to save the baby's life. The operations include the hybrid stage 1, comprehensive stage 2, and Fontaine completion, all of which are shown in other videos.